Hi, everyone. Courtney DiNardo here from MD Anderson in Houston, Texas. And today I'm just going to briefly talk about how treatment with venetoclax with hypomethylating agents may improve quality of life and post-transplant outcomes. These were two different subset analyses from the original Ven-HMA studies that were presented at EHA this past June. And so I'll start with the quality of life question. This was something that was presented by Keith Prats in an oral presentation where he looked at and reported the VIALE-A specific data on PROs. So patient-reported outcomes were measured on the VIALE-A study. Three different validated measures, including the EORTC, the PROMIS-fatigue scale, and one called EQ-5D-5L, which measures cancer-related symptoms, health status, functioning, fatigue, and these outcomes were collected at the beginning, cycle 1, day 1, and then every other monthly cycle. And overall, what the study found is that it took longer in terms of deterioration of these various different health-related scores, meaning that when you're treated with azacitidine and venetoclax, in general, patients had a longer preservation of good functioning. And this was also seen, better functioning was seen in patients who achieved a complete remission, who became MRD negative, who started with a better performance, ECOG performance status. And so the treatment arm, the Ven-Aza, was also consistent with improvement. And so this helped to, highlight that not only are patients benefiting in terms of improved response rate and improved overall survival, but patients are actually having good quality of life also with this treatment. So that was a great correlative endpoint to look at. The other question was specific to outcomes of transplant in patients that have received Ven-based combinations. And this one actually pulled from both the VIALE-A study, but very, very few people actually went to transplant in the VIALE-A study. So they pulled also from the original phase 1 of venetoclax with either azacitidine or decitabine. And overall, 33 patients in both of these studies went on to receive a transplant. So this is small compared to the overall population. Of course, in general, these patients were younger. The median age was 69, I believe, compared to like 76 in the overall population, because younger patients in general have better performance status and go on to transplant. About the majority, like 60% or so of patients, had adverse risk disease. Again, something you would anticipate. Younger patients who did a bit better with therapy were able to transition to a transplant with the goal of transplantation in these patients. On average, patients had received 4 cycles of Ven-HMA before transitioning to a transplant, and most patients were in a complete remission or a complete remission with incomplete count recovery when they went to transplant. Of the patients who went to transplant, so there were 33, 9 of them had achieved MRD negativity. 16 of them were still MRD positive, and the remainder hadn't been assessed. So actually, a minority were MRD negative. And overall, what was seen was what we hoped we would see, which is that we did see an improved overall survival in patients who received Ven combinations and then went to transplant. The median survival in these patients going to transplant was 30 months. So 2.5 or so years anticipated median survival, and it was even higher in those patients who were ELN favorable or intermediate risk. Again, as you might expect. There were 2 patients with P53 mutations. One of them actually did quite well and stayed in a durable remission for over 2 years after transplant, which is anecdotal, but still nice to see. We don't see so many P53 patients doing well for a long time. And so overall, I think the point of this one is to say that in HMA Ven-treated patients, if they are appropriate for transplant, we certainly should think about transitioning to a transplant. These patients seem to do well and benefit from that. So those were the 2 updates, and thank you so much for your attention.